morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
Good morning. Welcome back to Insurance Matchmaking. I need to start off with a correction. And I think as I mentioned before, when I was talking to you, I was in that morning. It was October 1st when I actually was recording. So some of the numbers and things were out. But prior to that, we did not have firm numbers on like premiums and deductibles and co-pays, all that on the Medicare plans. And I said, well, at least this year we're going to have two Part D drug plans at a zero premium, and that actually wasn't correct. We are going to only have one, but it's not the one that was zero premium for this year. The plan that is currently zero premium is going to $360. So, and again, it's one of those, that zero premium plan that we do have this year is still not a plan that all receive commission for. But if you're interested in switching to that zero premium plan, I can help you with that. It's really quick and easy to make that switch. If you're not, so like I said, if you're not taking any prescriptions, or you're taking one or two low-cost generics, your drug costs are going to be the same on each plan. But hey, if you don't have to pay $360 a month, then that's over 36. Well, actually, I think turns out it's like $43 for the year when you add it up. 3 times 12 is 36, and you add the 60 cents, and I'm not going to do the math right now. I guess I could have done that before the show, but that's that one. And then also some of the drug plans are really going up in price, and I have a carrier who's actually lowered premiums on a couple of their plans. I'm not going to say the name of that carrier today. I got to be really careful about, especially with Medicare, if I'm talking about certain benefits of those plans and use the name, then there's all kinds of other disclaimers and things I have to do. So I'm not going to mention names of plans, but if you want to contact me, email, call the office or something, or set up an appointment, I'll share all that with you. But I'm not going to do it on the air. I've invested too much into my business and my license to have something jeopardize that by me misspeaking on the radio. And when I say misspeaking, I'm talking about using a name of a company and not having permission to use the name. I could be perfectly factual in everything I say, but if I don't have clearance to use their name when I'm talking about their product, then I could be in trouble with that carrier, and they can just suspend my license. I say suspend my license. They can't suspend my license, but they can suspend my contract and put it to where I can't write that plan anymore. So that's an issue. The not having a carrier that, if it's a carrier I write a lot, it makes it very difficult, especially if it's very popular. So I'd like to be able to keep doing those plans. Just got a lot of different things going on. We are still just in the pre-AEP of Medicare. This Saturday, today as you're listening to this, if you're listening to the initial broadcast, I am not working this Saturday. As of right now, at least as I'm recording this, I am not planning on working this Saturday because I will be working most of the next Saturdays until almost Christmas. I do work the Saturday after Thanksgiving. I am taking off at the office. Well, I say the office will be closed. Elijah or Bree may decide to run some appointments on November 8th, but I will not be in the office that day. That is, as I've mentioned a couple times on the show, that Saturday is the Saturday before Veterans Day, and that's when a lot of veterans activities and parades are happening that day. And my grandson, who is in junior ROTC at Kenwood High School in Clarksville, they're marching in the parade. So Janice and I will be driving to Clarksville to be there for that parade and spending some time with the grandkids there that Saturday, because the next Saturdays I'm sure we'll be running appointments and things, and that's in November. So that's when I'm doing the under 65 Affordable Care Act plans and also Medicare at that time. So I put out, and I think I mentioned last week, maybe the week before, on those Saturday appointments, if you can fit in during the week, we'd appreciate do that. Sometimes there's people who just can't come but on the weekend. So, and usually if you can make it during the week, most people don't want to spend their Saturday in an insurance appointment either. But a lot of times those that are still working, or one spouse is working, or that just happens to be their day off, need to come in on a Saturday. And I'm asking, even though November 1st is a Saturday, I'm asking my under 65 people if they're going to book a Saturday appointment, wait until November 15th to book those. Just gives me that little bit more time to concentrate on the Medicare people, because their deadline comes up before the under 65. And most of the under 65 folks, if you're a current client, most of the time you're not going to need to do much. We do ask, again, everybody to update their, go ahead and on the calendar. When you go to the calendar, in the instructions for that appointment, there are links for a couple forms. We do ask you to click and submit both of those forms, one being the CMS consent form. And even if you did do one last year, we still would like to get one for dated this year, just to have on our records, so that we don't have any issues with CMS on that. And then the other is the client information form, which goes into into Google. And it's just a Google sheet. But things change. Maybe you had a child who was on your insurance, and now they're a little bit older, and they've got a job they're getting insurance through their job, or they've gotten married and they're getting through their spouse, or just the fact that they turned 26, they're no longer on your insurance, or you've had a baby born during the year, or you adopted a child and hadn't told us before, or maybe you were still in the process. Please update us on those things, because those affect what you're paying for your insurance. And then the other one is your income. And it was stated before, Social Security or disability, those are generally not taxable income, but for the purposes of calculating for marketplace coverage, those do count as income. And if it's your spouse and they're on Medicare, and that Medicare premiums coming out of that Social Security, send us the gross. It's just like with a paycheck, before they take out your taxes, the gross amount. That's what we need to enter in. And I was talking to somebody yesterday, and one of the big things on that is it's not that big a deal if we're off a couple $100 a month on your income for figuring the tax credit, and it's not going to affect the tax credit that much. But when you go to file your taxes the next year, if you underestimated your income by $200 a month, and that's so that's $2,400 a year, that's going to lower. And then not by a great amount, but it will lower what you're eligible for your tax credit. Example I used was like, well, now if you lost $20 of tax credit eligibility because you were overpaid $20 a month, that's $240 for the year. That's going to get added back to your tax bill. So if you thought you were going to get a small refund, and now you're not, you're having to actually pay some in because you went over that, or it's reducing your refund if you had a decent refund. So it's always better to overestimate a little bit on your health insurance income, your income for your health insurance. And it really helps us if you put that on that Google sheet that you fill out. And it's also very helpful if you can break it down, husband's salary from the job, husband's retirement pension, wife's Social Security, and if we have those separated by whose income it is, we can do pretty much most of your application, especially if we've already done your application. We just need to go in and edit those dollar amounts. We might save a lot of time, because we can just go ahead, put all that info in, come back and say, okay, looks like this is the plan you need to have, or staying on the plan you have is still going to be great, or hey, I recommend you switch to this plan for this reason. Especially if you've had a substantial change in income, it really is going to make a difference. We maybe had you at a silver plan this year, and next year we're saying, bronze might be a little bit better. You're going to pay a lot less per month. You will have a higher out of pocket. And then the flip side is sometimes people we have on a silver plan, a gold plan is actually going to make more sense for them. It doesn't apply to everybody, especially if you're getting a good chunk of what that's called that cost sharing reduction. And the way that works is if your income is below 250% of the poverty level, then you will receive that cost sharing reduction that can be used on your silver plan. So that will lower your deductible, your max out of pocket, and your copays on a silver plan. Won't on a bronze or a gold. Now your tax subsidy is going to be the same, but so how it affects a premium is the same whether it's a bronze, silver, or gold. It's that cost sharing reduction on the silvers that comes into play. And if your closer to that 250% than 100, the 100 lower end on the 100%. If you're like at 150% of the poverty level, yes, a silver plan is probably going to be your best fit because you're going to have a very low deductible and a low maximum out of pocket. If you're, closer to that 250, you still get a cost sharing reduction, but the deductible and the max, not always the max out of pocket, but the deductible will be lower on the gold plan, and those copays will usually be lower. And there's very little difference in the price between the silver and the gold plans. At least they are this year. Next year could be different, but a lot of it is the silver plans, that cost sharing reduction, that's a subsidy from the government, and so they're depending on the government to subsidize that along with the premium. So those are a couple things that will happen with those. So we will go ahead and do those, and we could go ahead and complete everything of your application, and then you send a text or an email to you that you review it and approve the enrollment. Like I said, you may not even have to come in the office. We can do those all fairly quickly. Now, if you're brand new, you've never worked with us before, yes, I would rather you set a time to meet with us first, to go over all of that, because if you haven't worked with us, you don't know how we work. But if we've been running your health plan for a couple of years, it's just a matter of renewing. Maybe, and I have a lot of clients that, last year we didn't even talk. It just automatically re-enrolled. This year, I think we do need to look at that. So anybody that didn't actively renew their health plan last year, they just let it automatically renew, I do suggest we take a look at that this year. So if you work with someone in my office, reach out to that person. Obviously, if you need to schedule an appointment, you can go online to the website, and that's also on our MattLibbyInsurance.com website. On the About Us page, each of the agents there have a link that says work with them. So it says work with Matt, work with Khalil, work with Elijah, work with Bree. You click on that link, goes to the calendar, and that'll show the available appointment slots that each agent has. So you can schedule that. You can set it up to do a Google Meet. You can set it up to do a phone call, and also set up to come to the office and meet there. And I always tell people, you can set it up, if you want to meet somewhere else, I'd probably say set it as phone call, and I think even when you're setting the appointment, there's a comments section there that you can comment and say, hey, I put this here, but can we meet at the McDonald's or Panera or somewhere, that the office is not going to be convenient to you, or something like that. So if you would prefer to try to do a other location, that's where you would do that. Now, most of the time, I'm going to request that anybody either do a phone, Google Meet, or come to the office. But the other agents may be willing to meet you somewhere else, especially if you're, because Elijah's living in Pikeville now, so if it's somewhere there or Dayton, it may be easier for him to go to you. So just reach out to each agent and see if that might be how they want to do it. So we're up on the commercial break here, and I'll be right back after a couple minutes.
TriLite, the people who bring you better internet, are now bringing you better wireless. Introducing TriLite Mobile, a new wireless service for our area. Enjoy nationwide coverage, the freedom to bring your own device, and budget-friendly plans, all backed by the local team you know and trust. Right now, when you sign up or upgrade your internet service, you'll get your first line free. Ask about TriLite Mobile today. Call 833-847-0824 or visit trilite.net. Some restrictions may apply.
The 29th Annual Cooking on the Square, Friday, October 31st, presented by the Willow Point Group, Baird Private Wealth Management. A huge thank you to all our sponsors who make this event possible, including Truist Bank, Averett Express, Cookeville Ford, State Representative Ryan Williams, Cookeville Regional Medical Center, the Realty Firm, Tier 1, State Senator Paul Bailey, and Putnam County elected officials. Tickets are on sale now at local banks, the Habitat Office, Habitat Restore, or uchabitat.org.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, and we're back from those commercials. Welcome back to Insurance Matchmaking. I was talking before the break there about updating your income and scheduling appointments. One of the things I wanted to cover, I was reading something this morning. I am probably going to get a little political here, and I apologize, but facts are facts. I'm trying to keep emotion and opinions out of things. But there was some post about the government shutdown. Now, as I'm recording this, we are still in the government shutdown. I don't know, once you hear this on the radio, we may be past that. So, we've had shutdowns go for 2 weeks, and we've had shutdowns go for 2 days. So it's hard telling, when they'll come to an agreement. I did see that supposedly, and again, this is just stuff that I've read, that the Democrats were holding out because they are pushing to get the extension to extend the expanded or enhanced subsidies, and that's actually one thing I actually support. It was very helpful this last year for those people who were just over that 400% of the poverty level, that they could still get a tax credit because they didn't fall off that cliff at 400%, because people are used to getting quite a subsidy on it. But I saw something posted this morning on that line that my understanding was the Republicans actually offered to go ahead and extend those tax credits, and the Democrats still rejected going forward to end the shutdown. So I'm not sure what else they're pitching for, but they're saying that's what they're fighting for, and then it was offered. They still turned down the plan. So there's something else in it that they're fighting for, and the Republicans are saying because they want to spend money on through health care on illegal immigrants. So I'm not going to get into whether that's true or not, but the fact that the main tenet that they said they are holding off on passing the reconciliation bill and ending the shutdown, they rejected. So I'm not sure where they stand on that. The other thing what I was talking about, I read this morning, I saw a post, and somebody posted that, a couple making, and I don't remember, it was $82,000 a year, something like that, was paying $524 for their health insurance, and now they're going to have to pay $2,200, and they blamed that on the Republicans. And I started to post something, and I was like, well, that's probably not going to work out well. But the thing is, a couple that was making around $80,000 a year prior to President Obama making health care affordable, yes, that's with air quotes, $500 and some was a common premium for a household. It's not necessarily just a couple, but for the family. So that $2,200 cost for a couple is the inflation. A lot of the inflation due to the healthcare costs have risen because the plans were subsidized. Like I said, I'm trying not to be too political, but a lot of people pushed for the Affordable Care Act to be passed because they thought I think the general consensus was, a lot of people thought that if you had insurance through your employer, you didn't pay anything for it, which those that have been on group plans for years know that they've always had to contribute, and also since the passing of the ACA have seen those costs go up for themselves. They've also seen their employers drop their spouse and family coverage, or we're going to say dropping it. They stopped paying for it. A lot of people, yes, they paid $200 every 2 weeks out of their paycheck to cover their health insurance, but that was covering their whole family, and it didn't really affect them. And the reason most people didn't have insurance prior to the ACA, now of course there were some that maybe had lost coverage and now had pre-existing conditions and couldn't get it, but then again, those really were more or less outliers. There wasn't that many people who couldn't get insurance because of pre-existing condition. Most of the people who didn't have health insurance was because they weren't paying for it, because they thought $500 a month for a couple's health insurance was way too much, and it was actually relatively affordable at that time. But with the passage of the ACA, the monthly costs skyrocketed, I wasn't doing health insurance prior to the ACA, so I can't compare a lot. It's going to be kind of anecdotal in knowing what people were paying. But my point on that was, I've seen the insurance, the premiums go up considerably from 2014 when people were first getting on those plans to what they are today. 5 years after 2018, 2019. those monthly premiums had about doubled. And the thing was, people didn't notice them doubling because as those premiums increased, so did the subsidies. So those that were eligible for the subsidy would go ahead and still pay, about the same amount each month because their subsidy went up. And I've explained this several times on here, and to repeat it is the subsidy is based on the second lowest silver plan in your service area. So it's not, living here in Cookeville, it's not going to be based on the second lowest in Nashville. It's going to be based on the second lowest in Cookeville. It's going to be based on in the county that you're in or that immediate region. And what happens is, and I was looking at some plans yesterday, the plans for like Chattanooga and Nashville and Knoxville, and this is one of those times I am going to say a company name. Blue Cross does offer what's called the E network. Most people on the marketplace are going to get the S network. That's what we have here in the Upper Cumberland, what Blue Cross offers. But in those higher populated areas, they do also add an E network. And the way that works is because it's a denser population concentration, that they're able to negotiate to set the reimbursement rate for the providers at a lower rate, and that passes on to a lower premium for the plan. And the reason I bring that up is you can have a plan, Blue Cross plan, in bronze, silver, or gold, and have that same exact plan be in the E network and the S network. And the plan is exactly the same for you as the member. The copays, the deductibles, the max out of pocket, what it covered, your drug formulary, 100% exactly the same. The only difference is the premium is different because of the negotiated reimbursement rate with the providers. That's the doctors and the hospitals. I've seen like a $200 difference between an E-network plan and an S-network plan. And like I said, I think I can get away with saying that because it's accurate. I'm not slamming Blue Cross on this. But it hurts those that live in a rural area but are included in that metro. A lot of my experiences with East Tennessee, when I had my office in Roane County, and my Roane County clients and my Morgan County clients and Sevier County clients, they are all considered in that that Knoxville market. But that E-network, the only hospital in the network is at the University of Tennessee. None of the Covenant, not Tenova, do not take that E-network. And when you get into those outlying areas, you can't find a local doctor that will take that E-network. So it's not a good fit for them, and so they have to get the more expensive S-network plan to be able to get doctors or hospital B in network. So they end up having to spend more. So I'm not a fan of the E-network. I understand why they're doing it. It's a cost savings. It's a cost savings for the insurance company. I just think it should be a little tighter area, not the whole. Just because this is the region that's considered that region. Like with Knoxville, it shouldn't be out. It shouldn't necessarily be a county that touches Knox County. My base being in East Tennessee for years. I lived in East Tennessee when we went to the 865 area code, and so basically every county, an 865 area code was every county that touched Knox County went to the 865, and there may have been one or two counties that didn't border Knox County but still had the 865, but every county that bordered Knox County had the 865 area code, and every one of those counties is in that Knoxville market. And like I said, Morgan County is also in that market, but they're still 423. But it just, that E-network doesn't work for those people. I mean, they can get the plan, but they have to find a doctor in Knoxville. If they need to have anything done at the hospital, like a knee surgery or anything like that, it's got to be in the facility that takes it. So it's really tough to find it. So, and that's, again, one of those reasons why you work with an agent instead of signing yourself up. We had that problem back in 2014 2013, 2014, when people were signing up that first year on the program, they're like, well, here's this plan, and it's going to cost me $0, but this plan's going to cost me $70. Why would I sign up for this plan at $70? And they signed up for they went for the lower premium, and then couldn't find a doctor who takes it. And then they're like, well, this doesn't cover anything. And it's like, well, it covers, but you got to find a doctor that takes it, or you're going to have to come up with the deductible before it starts paying. So there, again, I just beat the dead horse. Talk to an agent. It doesn't have to be me. It doesn't have to be my office. Don't call an 800 number. Find somebody local. I'm not the only person in town. I'm definitely not the only person in Tennessee that can help you with that. And I know agents in the other counties that, or if you're in Kentucky and you want to talk to somebody that's in Kentucky about your under 65 health insurance, I've got people I can refer you to and say, here, talk to this person. They'll treat you right. They'll treat you just as well as I would, and you can trust what they have to say. So I didn't realize I was going to talk as much about the under 65 health insurance today, since we're in the Medicare season. I do appreciate a lot of my clients have been filling out the form we call the Retire Flow. It's really simple to do, and one of the things Medicare requires me to do is I'm supposed to have your permission 48 hours prior to meeting with you or recommending options for your Medicare. If you come to my office, there is an exception that you can sign the form there because you were a walk-in. I can do it, but we still ask people to try to go ahead and fill out that Retire Flow, because one of the things that really helps is it's going to ask you who your doctors are, who's your where's your your preferred hospital. It's going to ask you what pharmacy you use, ask you to put your drugs in, and you don't have to remember exactly how to spell your drugs, but you do have to get like the first few letters in the right order. If you transpose a letter, you go, wait a minute, I can't find my prescription. I do it all the time. Something that's going to be IR, and I'll type RI, and I'm like, why is this not coming up? And then I look, I say, oh, I switched the letter, and then it pops up. Be very careful when you look at the dosage that you're taking, because some of the plans will have capsules or tablets. Please make sure you mark it accurately, whether you're taking a tablet or a capsule. If you're getting a solution, an ointment, and especially like on the insulins and the insulin similar items that you have vials that you would drop in a syringe, and then you also have the auto pens. Be sure you're marking the right one. And then the last part of that is that scope of appointment form. I always ask everybody, go ahead and initial, and it does ask for your initials, not just a check mark. Put your initials in the box. And I ask everybody, just go ahead and initial all 5 boxes, because it just helps us if we're going to, if we kind of drift into another section, or you write, oh, I should have asked you about this. We're all legal because you signed that. It's not obligating you to purchase a certain thing. And if you're a client, I already know what you already have, but I do have to have that signed. But we ask you to fill that out before you're coming for your appointment, so we can because one of the things that's most time consuming on a Medicare appointment is putting in all your prescriptions to see which drug plan or which Advantage plan is going to be the better fit based on your prescriptions. And also, again, on a Medicare Advantage, who your doctors are. Now, if you're just going to look at a drug plan, or you have a Medicare supplement, you can skip the doctor part, you can skip the hospital part, because it doesn't matter. Those networks only matter with the Medicare Advantage plan. So actually, I'm up against the deadline, or the clock here. Till next week, we'll talk to you on Insurance Matchmaking. And, of course, always go to insurancemattchmaking.com or mattlibbyinsurance.com. And remember, at Matt Libby Insurance, we can cover you from head to toe. It doesn't have to cost you an arm and a leg.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.